Welcome back, you guys. This is the Everyday Hero Show where I bring to you someone in your life or someone in my life that brings us joy, happiness, and good things all around, but does not get the credit that they deserve. This week, we have another nurse on the show. Sarah, welcome to the show.
Thank you so much. I'm so happy to be here.
Well, thank you, thank you, thank you. I really do appreciate this, Sarah. I really, really, really do. Like I was just saying prior, I haven't done this in a while, and it takes a lot out of me. Like during my traveling, it's like getting to know a nurse or getting to know someone at a hospital, and them like impressing on you enough for you to want to have them on a show like this. It takes a lot, right? I've been at the hospital that we work at for a good enough time. I just talked to one of the managers that we both know. I really like the hospital we work at, so I just wanted to say thank you. The hospital you work at, we work at, is absolutely fantastic, and I've had such a good time there.
Absolutely. Yeah, you've been a wonderful asset to the team as well. So that's what makes good nursing.
Yes, so let's start from the beginning. I asked this to everybody. Three very big questions. Take it however you want to. Who are you? Where are you from? And why nursing?
Well, I'm Sarah, and I am from Littleton, Colorado. I actually was born at Littleton Hospital where we work. I don't know if you knew that, but
Are
back
you
in the
serious?
day,
Are you
yeah,
serious?
yeah. So I
Hey,
was
that's
born
amazing.
there. I lived down the way, so I haven't ventured out too much, but it's a great place. I love Littleton Hospital, and I just love the area. It's great. So, but nursing, it's been kind of a path for me. I don't know. Everyone has their own story, but originally I didn't want to go to nursing school. I was like very hesitant. I was like, no, no, not for me. So I went into school to do health and exercise science, still medical. I still wanted to do something in that field, but wanted to either do like athletic training or PA school was my big focus. So I finished my 4 years in undergrad, and then I started working at Littleton to just get some experience, get some hours under my belt before applying to PA school. And then after working with the nurses there, they just have such an amazing team. They made me realize that I love bedside and like actually doing the skills where, I mean, PAs do the skills too, but nursing, it's like you get to start IVs, you get to do catheters, you get to talk to patients and family. I'm like, wow, I really like this. And so then after like a year and a half, 2 years, I changed my tune and was like, maybe I'll go back to nursing school. And so then I actually went to an online school through the University of Wisconsin, and it was a accelerated online nursing program that started in February of 2020, and then COVID hit March, and I did my program all through COVID. It was perfect in my world because everyone was trapped inside. I was just trapped inside doing homework. So yeah, then
um,
I graduated in 2021 and just, moved up and did nursing at Littleton. And I love it. I absolutely am so happy that I did that.
so there's two things here, and that really surprised me. I felt like I knew that you weren't you haven't been a nurse for too long, but it does really surprise me, right? Like so there's very different reasons I ask people to come on the show, right? The manager that I had on previously, I because I've never seen a manager do what she does. And it really surprises me, Sarah, that you've only been a nurse for a short amount of time. Can I ask, what did you do at Littleton prior before becoming a nurse? Because you give off a very like competent like aura when you're on the floor. Like you're very efficient. You're on your shit. Like you're always asking for help. So like, and that's why I wanted you to come on, because and you haven't been a nurse for that long. I feel like I was never that confident in my nursing up until 3, 4, 5 years into nursing. So the fact that you just started and you have this aura of just like I know my shit is kind of impressive.
Oh,
So
well, thanks.
what did you do prior to being a nurse at Littleton, and how did you how did you is this something that you just put out? Is this just you, or do you
No.
feel like go ahead, take it away, please. Explain to
Okay.
me.
Well, two things that I could think of. One, I've worked at Littleton almost for 5 years now. So 3 years under my belt there before I became a nurse, which is helpful.
Okay.
You know the staff, you know the people. I started as a CNA and did CNA for a solid year, and then started transitioning into other roles. So, you already have to learn a lot as a CNA. You work bedside, you get really comfortable just talking to patients, being around them, interacting with family, and you kind of build that confidence because that's half the battle. I mean,
Yep.
I feel like you can definitely tell when people have been a CNA before and then go to nursing school versus the people who've never worked in healthcare and go to nursing school. You just are shy at first. Of course, I was shy when I started as a CNA, but just, you get used to the people, the things. Um, so I did that. And then I did unit coordinator when we had a full-time unit coordinator, which we don't anymore, but we
Yeah.
did have a full-time one. So I did that. And I was just forced, like, as a unit coordinator, you kind of have to do all things not nursing related that no one else knows how to do. So I
Yep.
spent plenty of
Yep.
days being like, I don't know how to do this. I don't know how to do this. But it's like after a while, you're like, well, neither does anyone else. So you have to figure it out because if you don't figure it out, then it's not going to get done. So
Exactly.
I like had to just get comfortable being really uncomfortable and learning like, well, who can I ask? I can talk to them. If they don't know, I'll talk to them. And, that helped. Then I did trained as teletech and I did teletech for a while. And so just like kind of bouncing around, it's like wherever they needed me, they would just throw me there. So that helped at least in my nursing skill in the tele realm, and being confident reading strips. And then you kind of gain your confidence with the nurses. They know what you're talking about, So that helped. And then I actually helped in cardiac services doing EKG tech. Um, some days. So I would come in and do EKGs around the hospital. I worked in stress testing. So we would do stress tests. So I just got to meet so many different people in the hospital. And then you just build those relationships. So walking into nursing, I already kind of knew all the people, which helps. I knew where things were, who people were, who to talk to. And half of that, I mean, that's half the battle of nursing.
Yep.
It's just getting
Yeah.
confident with all your peers and um, where to go. Also, after doing all that, going to nursing school, it's because it was an online program. They set up my clinicals for me, but I kind of had to walk into every place and be like, "Hey, I'm here. I'm the student." Like I didn't have or I had a preceptor, but I didn't have like a
Like a
person that
guide.
walked us in. Yeah.
Yep.
Or anyone there's being like, okay, this is when we're taking lunch. This is when we have to show up. This is when we have to leave. Let's do a huddle. Like I was just there by myself. So I would have to walk into the hospital, set it up with the manager, find a preceptor, be in contact with them. I'm working these days and just be like, okay, I'm coming this day. Like you ready for me? And you just have to be comfortable because you don't have that person there holding your hand. Of course, it was scary at first. But then we had 5 clinicals and I did 3 of my or rotations. I did 3 of my 5 on 5 North, which was super
Oh wow.
helpful as
Okay.
well
Yeah. Yes.
because it was during COVID and no one would let us go and do clinicals. But because Renee knew me and our old manager knew me, they were like, sure, Sarah can come. She's already here working anyway. So she can do a day of clinical with us. So all of those things together, I mean, looking back, I probably would say that's what gave me my confidence. But if I went to another hospital right now as a new nurse, I would definitely be shy. You just have to work your way into it.
I love that answer because it's so true. And the thing that you learn like the quickest about being a travel nurse is it's not like the skills are the same, the patients are the same, you're just in a different hospital, right? The thing that is the hardest is how do you contact the provider? Right? Who do you call when you need X, Y, or Z? Where do you find the supplies? Right? All of those things make like the things that are surround nursing, because nursing is always the same. And someone who has a heart attack in Boston is the same. It's not the same, but the
Yes.
treatment is the same wherever you are. It's just the stuff around that takes a long time to understand, to get used to get comfortable doing. And I think you crystallized it. And your experience, you were a CNA, you were a teletech, you did the EKG, the UC. You did literally all of the things that has to do with nursing prior to being a nurse. So
Yeah.
I can definitely see where the confidence comes from. But just going back a little bit, when you were deciding, when you were making the switch over, when you were deciding that you wanted to do, I don't know what is it called, like PA school, or
Yeah.
what does you said, physical science,
Athletic training.
athletic training. When you
Yeah.
were deciding to do that, what was the reasoning? Is it because you just played sports your entire life? You knew you wanted to be in any healthcare? Do you have family in healthcare? Like, what was? How did you come to that decision?
Totally. So I don't have any family in healthcare. Well, my grandma was a nurse, but she has been retired like my whole life. So, um, I have always loved science. I'm like a science person. So I'm like, what can you do that's science? I've always loved sports, always. And so when I learned about health and exercise science, I'm like, oh, this is great. And usually when people get a health and exercise science degree, it's to do either pre-med type stuff. People go to
Yep.
med school, which I know I didn't want to do that because it's just a big commitment. And I value my family and not that physicians do not, but it was
It's
just
a lot of
not
time. Yeah.
it was just not my path. It was going to be, too much. And so, PA was like similar, but a little bit different. And I knew you could work with a bunch of different types of people, or athletic training, which we didn't have any of those programs at CSU where I went to undergrad. But I know other schools had athletic training degrees. My fiance is actually an athletic trainer, and I'm like, you had my dream job. How did you get that? But it's like, it's hard. It's a hard job to get into. And, you can sit there forever like I did and be like, oh, I'll get lucky. I'll get a job. I'll get this. But it's like your life for the rest of your life is just laid out. You get to do this for the rest of your life. And after a while, I'm like, I don't know, I didn't try that hard to get into schools. I don't even think I applied for a PA school, but just looking at the qualifications, knowing the people in my same class that were applying for that, not getting in time after time after time. I'm like, I don't know that I have the energy to do this. And I can do something I enjoy that's like, not as strenuous. And it might be different pay originally, but it's the same skill set. So
Now seeing your fiance's job, are you still jealous? Like when he describes what he does, are you still like, I feel like I could be, I feel like that would be better suited for me? Or are you like, I think I made the right decision being a nurse?
well, I know I made the right decision being a nurse. I think it would be fun to do what he does, but I get to see the glamorous part of it. I've seen more the non-glamorous side of it. It is unfortunately a very male dominated profession, which is changing a little bit. There are some females involved, and but it is pretty male dominant. It's very, very taxing. He works like 6 days a week. He's there before games. He's there after games. He's there before practice. He's there after practice. It's very time consuming. But then again, he gets to be outside all day, every day. He works for soccer. So just watching soccer and hanging out, if someone gets hurt, then there he is.
There he is.
So I'm like, I think it would be fun, but also nursing is just so amazing. I'm doing cardiac right now, and I'm like, I just love cardiac and knowing the heart and knowing all of that. And even just little things that you can do, like wound care. We do wound care. I have family members come to me, or any other people that are like, can you help us with this? Or, and I'm like, I just like being able to do all the things, whereas he's more focused on
a very specific.
Muscles and tendons. And I'm like, I'm glad that I went into more organ based.
So and that's a great transition, because I did want to say we did work together on a tele floor. You were a tele tech. You did do the EKG, so I can definitely see your path into the cardiac realm. Like it kind of just winnowed down. And then you just recently, are you okay with us talking about the Cath Lab switch? Yeah, you just recently made this switch into the Cath Lab. Why the heart? Why cardiac? And is the Cath Lab more cardiac than working on a tele floor, or is the Cath Lab more OR? Because in my head, the Cath Lab seems very OR like.
Totally.
Right? Yeah, it doesn't like I feel like being on a cardiac floor, you're dealing with all of the heart failures, the AFibs, all of that stuff. But in the cath lab, it's like you come in, we put you under, we stent you, you get out. So, right? Like, so describe the difference and which do you feel like you are doing more heart stuff on? On which floor do you feel like you're doing more heart stuff on?
Yeah, absolutely. Okay. This is a good question because I feel like everyone thinks the same thing. So
Yes.
thanks for letting me explain it. So, um, first of all, I've always loved cardiac. Like ever since we started learning in high school, college, all of our anatomy and physiology was like when we got to the cardiac section, I was like, yes, I love this section. It's so fun. Like it makes sense to me. Like, all the other stuff. I'm like, okay, I like learning about the other stuff, but cardiac in nursing was like my thing. So much so that we actually had an EKG class in college that I was like, yes, I took it as one of my electives. And that's kind of
Oh,
how I got
wow.
into EKG. And it was like a whole semester long. We did stress tests on each other. We did EKGs. We did all this stuff. And so going to Littleton, I already knew that I loved cardiac stuff. Then I got on the cardiac floor. I was like, oh, this is perfect. I've always loved this. And then to be honest, when I started working as a cardiac nurse, I'm like, I don't know that I like this anymore. I always kind of toyed with the idea of going to NP school. I'm like, I'll be cardiac NP. This will be great. And then after seeing what they do, I'm like, I don't know that I love this. It's like a lot of heart failure,
Yep.
a lot of
A ton.
people, a ton, and a lot of in non-compliant patients that you're spending hours trying to figure out how can we make this person healthier and healthier. And you do so much for them and they go home and they are just non-compliant with everything. And 2 weeks later, they're back in the hospital. It's like, that's so frustrating. I like to find a person, treat something, and then see like huge progress and, great stuff. So and then I was like, I don't know if I would go to NP school, if I would do cardiac. But then I had this opportunity in the Cath Lab. So the Cath Lab is, I guess for anyone that doesn't know, it's like the OR, like you said, but for strictly cardiac heart stuff. So right now, Littleton only does cardiac caths, which is where they go in through the wrist or the groin and they go up with a catheter into the heart and look at the vessels that actually feed the heart. And if people's vessels are blocked, then their heart's not getting the blood it needs and the heart can't function. That's how people have a heart attack. So what they do is they go in, they stent, they open those vessels up, and then the heart can reperfuse. Right. So right now, that's all Littleton does in the Cath Lab. They they've had such an influx of patients that they needed a nurse that is going to do just pre-op and post-op Cath Lab nurse.
Okay, sorry. So they needed a nurse to do what exactly? What were you saying?
No, yeah, you're great. So they needed a nurse to do just the pre-op and the post-op of the cardiac cath lab. Okay,
Gotcha.
so I don't actually do anything procedural, minus the fact that the team is amazing back there and like so eager to get everyone to learn and like just so great. So anytime I want to go back in the OR, I can throw on some lead and go back there if we're not busy. And I've done that plenty of times. And so it's amazing. I'm just like standing there and they're like, Sarah, come over here, do this, do this. And I'm like, okay, but I'm not actually like a rolled nurse back there. So I bring in patients, I get them ready, educate them on what's going on, get IVs started, get everything started. And then they go back to the cath lab, they get their procedure done, they come back, I recover them for X amount of hours, and then send them home or admit them to the floor, whatever, the doctor suggests or recommends. And so I originally was like, am I going to be bored? Like, people say, oh, older nurses just go to PACU because that's where they go to retire or whatever. And I'm like, oh no, I don't want that to be me. But it is so fast down there. I thought I knew a lot about the heart with my background. I know nothing. So all those nurses down there are so smart. They know all the vessels of the heart like it's the back of their hand. They're telling me stents they put in this vessel, in this vessel, in this vessel. And I'm just sitting there thinking, oh my gosh, I know the names of those, but how do you know like what feeds
Exactly.
what and what does this? So having to know all of that, and they've been so great at teaching me all of that, getting me to learn that. We have reps that come in constantly. They do Impella down there, which is like, I always knew the name, but I never knew what it did. It like pumps blood out of the heart. It's pretty much like, I don't know. It pumps blood out of the heart so that the heart can have time to recover if it's like too hypertrophied or.
And is that only post-op? Like, do they do that for a short amount of time post-op, or is that like a device that people go home with?
No, they don't go home with it. They're
Okay.
ICU bound if they have that device in. And then eventually after the heart's recovered, sometimes, they'll do it for 24 hours. Sometimes it's for a couple days. But I'm like, I didn't know any of this. So learning the devices, learning how I've seen pacemakers put in, loop recorders put in, and I'm like, oh, wow, this is just so interesting. The doctors are so knowledgeable. The nurses are so knowledgeable. So I'm learning a ton. And then also something that's been a huge change for me is in the pre and post area that I'm, and all the nurses are pre and post too. They all help. But since I'm the main person out there, I kind of take over and, shuffle patients around, help out as needed. But 2 procedures that they actually do pre and post. One of them, we do cardioversions down there. So I do all the cardioversions on my own, which is fun. That's kind of like a procedure.
No, you don't.
I
Are you
do.
serious?
Yeah. And then
that's a little scary.
It
so,
is.
I mean, just like being on the floor, that seems very intense.
Totally.
Yeah.
And like, it's crazy. And we also do transesophageal echocardiograms. So
Okay.
TEEs, where they like take the ultrasound probe and put it down the patient's throat so they can look at the heart in there. And so that in my role, I'm the primary nurse for both of those procedures. So with a cardioversion, we have anesthesia in the room. I'm the one actually doing the cardioversion. I'm setting everything up, making sure all the connections are there. So that's been a huge transition because on the floor, like you said, like if you're shocking someone, your adrenaline's pumping, like it's scary. You're like, oh gosh. But down there, like I'm not kidding. Yesterday we did 6 cardioversions. Boom, boom,
oh my
boom,
God.
boom, boom. So it's just and one time we shocked a patient 4 times. Like, it's just crazy. And you have to, resync it. You have to make sure you are in charge of all that. And you're in charge of documenting and performing all at the same time. And you have to make sure their airway stays open. You have to make sure everything. So that has been fun to learn. And then with the echocardiograms, they actually don't use they don't get anesthesia to do the sedation. They don't use propofol. They just use fentanyl and Versed. And so because of that, I am the one doing all the sedating for them. I'm the one, the doctor kind of is there to tell you like, okay, you can give 1 of 50 of, Versed and fentanyl, but I'm the one being like, I think they need more Versed. I think they need more fentanyl, and like actually pushing the meds and being in charge of that whole thing, being in charge of airway. We had a patient the other day that her oxygen's at 40% as they're doing the TEE. And I'm just like, okay, oh, no. But like everyone down there is so calm, like things that we would call rapids for on the floor. They're just like, they know what to do. And we had to bag the patient. And they just were like so casual about it. They're like, oh yeah, this is what we do. Like, there's no reason to call a rapid. And I'm sitting there like, oh my gosh, like freaking out. So the pace is different. They have a little bit more flexibility, pressures have tanked. We've had a couple patients that I've gotten out of just one I've gotten out of the Cath Lab. They have some EKG changes they have to take back to the Cath Lab emergently. So it's just, and then, sometimes we get code blues, we get heart attacks. They're doing CPR right on the other side of the wall. And like, you wouldn't even know it. Everyone's just acting so casual. It's not a whole fluster. It's not a whole, they have their shit together and they know what they're doing. And I'm just like, wow, how did you guys do this? Like, I'm over here not even involved having a panic attack because, it just takes it just takes a while getting used to that and learning like, it's all good. We know what we're doing. We have a great team and just trusting your skills. So it's been a great transition.
Yeah, it does sound kind of amazing. And I too have an affinity for telemetry, the cardiac realm of nursing. In fact, one of my goals prior to becoming a travel nurse, I wanted to go into the CV ICU, right? And you know how like that training program, that onboarding program takes about 6 months. So it was like prior to travel nursing, my options were do this, become an ICU nurse, go to the cardiac unit, or be a travel nurse. I
Yeah.
chose the latter, but like now that I'm settling down, and I feel like you're right. And that's exactly what I wanted to ask you, because being in the Cath Lab, the patients that are going to the Cath Lab most of the time need it to happen immediately. So when you do have code blues, when you do have heart attacks, when you do have crazy rhythms that are happening to patients, because I don't hear code blues over the overhead in the Cath Lab that often. I definitely do hear it once in a blue moon, but I feel like the patients that are in the Cath Lab are usually having some kind of cardiac event or coming off of having a cardiac event. But I think you explained it really well. But I just want to ask a little bit more about that. You just told me that you guys don't call rapids for like situations you would regularly call a rapid for on the floor. When are you guys calling a code blue? When are you guys calling a rapid? How bad does it have to get before you need outside help to come to the Cath Lab? Or is it basically like an ICU where everyone that needs to be there is already there? So chances are you're not going to be calling the code blue or rapid.
Right. Good question. And to be honest, I haven't been down there long enough to know
Yeah,
in
I'm
particular.
sorry.
No, you're good. But the times I have witnessed, usually it's like a code blue from the ER coming in. And then by that point, like kind of everyone's there. They have a doctor, they have a hospitalist there, they have the nurses, they have all the meds needed. The only difference is if pharmacy needed to come over, like one day they actually did, I can't remember where this patient came from, but they called an intubation alert because she was just on way too much oxygen. But they were so casual about it. They're like, still,
I'm sorry. What is an intubation alert? They're on too much oxygen? What does that mean?
well, they need to intubate. So they need all the people there to intubate.
Okay.
Yeah. So I think anesthesia comes because we don't have anesthesia in the Cath Lab. We just use fentanyl Versed, but the anesthesia comes, pharmacy comes, and then respiratory would come.
Yeah. Do you guys
so
not have respiratory in-house?
No.
Like, okay.
No, not in the Cath Lab. But I think this patient was on a CPAP or BiPAP. And so they had come down and they were already like super high liters. And the doctor was just like, I think we need to intubate so I can finish this cath. Meanwhile, the patient's like fully draped. They're still just putting in wires. He's just like, I think we need to intubate this patient. All right, next wire, like going through. And I'm like, should I call? And then the charge nurse was just there. He's like, all right. And he just like calls it overhead. People show up. They're like, get in there. Boom, intubated, done, finish the cath, get her upstairs. Like 20 minutes. It was just like, yeah. And everyone that comes down, they're just like, all right, what do you need? And they're like, we're good. You can go back. But when they would call a code blue, I feel like if they needed that extra help, if they needed respiratory, if they needed pharmacy, and those are really the only two. Everybody else is there. So
makes sense.
I haven't seen it a ton, but yeah.
And like in my head, I know it's crazy to say because being a floor nurse is a different kind of nursing. It like takes a whole different level of skill, right? Especially when it comes to like prioritizing and deciding who gets what, who's first, who's last, all of these things, right? It's a different kind of mindset. But you're right. When you start talking to or witness like folks in different kinds of nursing areas, especially when it comes to like the ICU or the Cath Lab, or even if it's like a different area like L&D, you feel like they're a different caliber of nurse, right?
Yeah.
So my question to you is, do you think that any nurse can be a Cath Lab, or do you think it takes a certain type of nurse to be working in the Cath Lab?
I feel like any nurse can do it. Hold on, my dog's scratching on the door and I'm going to just let him in because
no, do you think?
Come on. He'll just sit on the bed. At least he won't stop scratching. Anyway,
What's his name? What's his name?
Jax.
Oh. What kind of dog is he? Ah, he's a cutie. Hey, buddy.
Oh, yes. He wants to join.
Of
Um,
course.
anyway, I feel like any nurse could do it. It does take a lot of confidence. And I always thought, because I worked in cardiac services before, and like I had some people down there that I knew, and they're like, when you graduate nursing school, you should come down, you should do this, you should come to Cath Lab. I'm like, totally, I'd love to. And the manager for a while was like, Sarah's kind of too new. I don't know that we can have her down here yet. And I was always kind of like, rude, you know me, like, come on, girl. And then now that I'm down there, I'm like, first of all, so blessed to be down there. They're all wonderful. But second of all, I'm glad she did that, because it does, you have to be confident in your skills, and you can't be that nurse. You know, when you're on the floor, you learn a lot, you do a lot of things, you kind of get used to, if you do have to call a rapid, you get used to, okay, what's my role in this? I need to do this. I need to do this, and be confident, instead of like when I was a CNA, I'd be flustered, like, what do you need? Glucometer? Like, you know, just like not knowing what to do. You're fumbling everything. Down there, it's like, you do have to be pretty confident in your skills. If they are like, Sarah put in an IV, they expect you to get that IV done. And as a new nurse, like that would be terrifying. You just don't
Yeah.
have the skill set. And it's like, okay, that's still kind of terrifying, because I'm like, what if their vessels are horrible and I can't get one? And then I have to tell them I can't get that. And they're like, we need to get that B. And I'm like, I'm sorry. Like, you know, but it's like, you have to just be like, okay, they gave me one role. I'm doing my role. And like, I'm getting this done as fast as I can for them, because I already know how to do my skills. You already know how to connect the pieces. You already know how to put, all that is second nature to you. But as a new grad, that would have been, you're still learning how to do each of those steps. And for them to take their time to teach you those skills, they just don't have the time to do that.
Yeah, that would be a lot.
Yeah, you have to be expected to know how to do that. But it's hard. And all of the, especially in the Cath Lab, like all of the devices and the swan and the this and the wire and the, I don't know any of that stuff. But the people that work in Cath Lab know all of it. Like there's no tomorrow. And the doctors talk so quiet. And I'm like, how do you even hear what they're saying? I would need hearing aids to work in the Cath Lab. But I'm like, I'd be like, what? What? Can you say that louder? But they already kind of know what they're going to say. So they hear it, and then they can just, out of all these cabinets, they go to the one thing and they just grab that. They know exactly what it is, what it's used for. And so I would be like, anyone who goes to Cath Lab, like you are going to be learning for 6 months to a year. It's almost like a new nurse, but you have the foundation under you, and then you do have to learn everything. I think anyone could do it, but it definitely takes like a very dedicated, I mean, not that any nurses are lazy, but you have to be motivated, dedicated to show up to work and be ready to do your job very competently every day.
Yeah. So. And that's the thing. And like, I've been talking about like your confidence and like, just like that, like just that confidence that you need. And it's a different kind of confidence when you are switching. It's not the confidence like, I'm here, I know what I'm doing, and I'm going to get it done. But it also takes a whole lot of confidence to let people know I don't know what I'm doing. Yeah. That takes a lot of confidence. Like, I'd say a little bit more so that if you already know what's happening, it's kind of just like what you're doing. But it does take a lot of confidence to be like, I don't know what's happening. Going into work, knowing that, I don't want to say that you're like not the smartest, but the least experienced in the Cath Lab, right? And like, you know that you have to be on your A game, if not A game, but just like attentive and ready to learn all day, while you're also taking care of patients. I feel like that takes a lot, like a lot, because everyone knows nursing school it's not easy. Being a new nurse is not easy. Right. And when you are starting out, it is very, very, very scary. You're taking care of people's lives on their worst day. It's not just like I'm here to just do my job. You kind of
drink my coffee.
It's a lot of responsibility.
Chill.
Exactly. Yeah, you can't. You really, really, really can't do that. Big question, just big question here. What do you think it means to be a good nurse?
Well, I think that to be a good nurse, for one, it's you have to know, you have to get the skills down, which is fine. It takes time. You can be a good nurse right out of nursing school. And new nurses don't have all the skills, but you have to be willing to be a team player. You have to show up to work, ready to work. And you have to be willing to always learn and take that constructive criticism, take that constructive feedback, and actually use that to turn it into do something different for your next patient. I think it's huge to have great communication skills, understand your patients, and, you know, just listen to them. You have to be friendly, be nice, and have a ton of patience, a ton of patience. And then secondary to that, I mean, you do need to learn the skills, but that all comes with it. You know,
Yeah.
it takes time. I've had plenty of times where my patient's like, oh, I totally trust you doing this and doing that. And then I need to do something on them that I've never done before. So I go to my charge outside and I'm like, how do I do this? I've never
Yep.
done this. They explain it. I'm like, all right, you want to come in with me? You know, you walk in and you're not like, I've never done this. I don't know what I'm doing. You're just like, okay, blah, blah, blah is here to watch us and they're going to help us today. And I just needed an extra set of hands. You work through it and you act like you're confident doing the skill, even though you're like, I don't know what I'm doing. But if you know you have that extra person there to help you, because if you never do it, then you're never going to know how to do it.
Exactly.
You have to do it at some point. So then it's like, okay, well, this makes sense. And I know the anatomy and I'm doing this. And, you know, if it doesn't work, they're there to step in. But you also have to you have to realize you're working on a patient. And like, if this was your mom or your grandmother, you wouldn't want someone who has no idea what they're doing, but is overly confident doing this. Because then if they mess it up, then it's like, well, then it's your fault. And this is a real person you're working on. You know, you have to be willing to say, I don't know how to do this, but I want to learn. Can you teach me? Can you show me this? But I want to do it. And that's my big thing is I'm like, I would rather do it, but can you be in there with me just in case something goes wrong or I'm doing something wrong? Please step in. Please tell me. Don't tell me afterwards. Tell me in the now. So next time I can be like, oh, when I was doing this, they told me not to do that. So I'm not going to do it this time, you know, but everyone has a different learning style too.
Yeah. And it takes, especially coming, and this is like to all the new nurses, it does take a while, right? Especially when you're coming from nursing school, like you're very like test oriented, you're very skill oriented. You think that being a good nurse means that you know all the things, but it's no, you have to be people oriented. You have to be like, it's like a good nurse is a mindset. It's not a skill set. Right. So you have to you have to be confident in yourself and you have to be confident enough to know when you don't know something. The skills do come. The skills will come if you're good, willing to learn and willing to ask for those questions. The reason I asked you that question is because just recently, I know every year they do this Gallup poll and nurses for the 20th year in a row have been named the most trustworthy profession. And I'm pretty sure this is just in the US. I don't think it's in the world, but for the 20th year in a row, nurses have been named the most trusted profession. And I do think it's a beautiful thing. And it makes me really proud to be a nurse, right?
Right.
But it is a lot of responsibility. It's a lot of responsibility. So I want you to tell the new nurses out there, what is the best advice you can give them to be trustworthy to their patients, to be a good nurse, to be as confident as you are? What can you tell them so they can be similar to you?
I feel like I would say just be honest with your patient and family. Like I've always had the mindset of just like, I'm not here to be over you in power. I'm not here to have you walk all over me and tell me what to do. I'm in the middle, you know, like from an adult to an adult. This is what we need to do. This is your health that we're talking about, right? So it's okay to make compromises. And I've realized that working in nursing, being like, okay, here's the deal. This is your fluid restriction for today. You know, you are so close to it. So let's compromise and let's do this much more right now. And then wait, or, you know, just making little deals like that and getting down to the level of not saying, oh, I need to do this because I need to check this box. Because for the longest time, for the first year in nursing, I think everyone goes through it, but you do your things to check your boxes and get it done. Make sure you're pleasing the doctor. But after that, it's like, okay, let's, you can compromise with your patients. You can say, if you don't want to take this med, that's okay. But let me make sure I'm doing my job in educating you why I'm giving you this medication. And if you decide you still don't want to take it, it is your health. And that is okay with me. I don't care. I want you to be healthy, and I'm going to educate you how to do so. But if you still don't want to take it at the end of the day, I'm not offended. I'm not mad at you. I'll still bring you dinner. Like, I don't mind. I'll still bring you a warm blanket, but I have to do my job in telling you that. And I've learned especially with family, with patients, if you're willing to make those compromises, if you're willing to talk to them just like they're they're not a friend, but kind of, and just make that connection, then they trust you more. They don't feel like, oh, she's just in here doing what she needs to do and getting out of here.
Yes.
They don't feel, but you also can't have those patients walking all over you, oh, if I just tell her that I don't want to do this, then she'll make me not do it. You kind of have to put your foot down sometimes and say, look, you haven't been turned in 6 hours. You are going to get a bed sore. I do not want that for you. I know it's uncomfortable, but we have to do this, or else in the future, you're going to be much more uncomfortable. Yeah. And so we're turning you and you have to be like, we're doing this. So and you learn that with time, you learn it with time, and just give yourself grace and just take each step and say, I can do my best today of what I know and what I can do. And before you know it, in 6 months, you'll be like, wow, I've come so far. Like, it really does make a difference. And everyone hears that. I heard that and I'm like, okay, sure. But it really does. Take it day by day. Don't get overwhelmed by the small tasky things. That's the advice I would give.
I know. And I think that's perfect, because, and like, I know the stress that just hospitals, management, whatever you want to call it, put on documentation. So your entire day, you're looking at that work list. What's next? Who's due? What, and you're right. It's just check, document. And like, your mind focuses on that, because that is how management, that's how the doctors know that you're doing your job. But Your actual job is taking care of the patient, right? All the documentation in the world is not going to, your great documentation doesn't mean that you're doing great patient care. Those are two very different things,
right?
Very related, but they're two different things, right? And when you become a nurse, in the beginning, it's like, I need my coworkers, my management, I need to do my job right. And the documentation, the task, the checklist is how everyone knows you're doing your job. The longer you are a nurse, you learn that's how people know you're doing your job, but your actual job is the patient. And you do really trend in that direction, where it's like, sure, if they don't want to do something, they don't have to do it, but let me do my education. Let me explain to them why the doctor is saying that this is the order, why you need to take this medication, why you do need to be turned. I absolutely love that answer. I think that's perfect. That's exactly right. And I think 90%, 99% of nurses go through that trajectory. I need to be a good nurse, go down the checklist. Okay, nursing is patient care. Absolutely. And like, I just see you. One of the major reasons I asked you to come on is because I've never been asked, do you need help more in my nursing career than when working on 5 North. And that's why I wanted to talk to the manager first, because the culture on that unit is so fantastic. And it sounds like you in the Cath Lab, that culture is hospital wide and not just 5 North, that specific unit, but you specifically are very, very helpful. I want you to talk a little bit about working with your coworkers. We've done a lot of patient talk. We've done a lot of talking about your education and how you are confident in your job. How do you work with your other coworkers? Because you've asked me for help so much, and it's like, literally, even when I don't need it, just knowing someone is looking out for me means the world. It means the world, because nursing is a very stressful thing. So what's your outlook? How do you go about with your coworkers, with your colleagues? How do you make that a happy place for you?
Totally. Yeah. This is one of the reasons that I love the idea of travel nursing, but people are like, what about travel nursing? What about travel nursing? And I'm like, I just can't do it, because for me, literally 50 to 60% of my job is my team and my coworkers. And I'm like, I just love that, knowing that they can ask me for help, knowing I'm comfortable asking them for help, and having that culture. And 5 North, you're right, does an amazing job. And they have the whole time I've worked there. But I think just knowing that, like, being a CNA there, and like when the nurses would be like, oh, do you need help? Or the nurses would kind of help out. It was clear, the nurses that were willing to help the CNAs. And I'm like, I love working with this nurse because they are so helpful and I don't feel guilty. And then you had other nurses where you're like, I don't know if I can ask them to get the blood pressure because I don't have time because they're not blah, 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 and you were just kind of scared. And so I always told myself, I want to be that nurse, not only for my CNAs, but for my coworkers, because I mean, that's, like you said, we're all there for patient care. And like, I don't know what kind of day they're having, you're having, anyone's having, but if I can be a little bit helpful and not sit at the desk for 10 minutes, having a sip of water and getting a set of vitals for the CNA so that they can take a lunch, it's like little things like that add up to make a full team. Like, I floated and worked on other units, and it's like everyone stays to themselves.
Yep.
And like, it's just not a fun day. Like, I don't have fun. It doesn't seem like anyone else is having fun, but those days when everyone's working together, it's like, hey, can you help me with this? Hey, do you want to help me with this? What do you need help with? And everyone's just like having a great time. It's a whole teamwork. I think the patients notice it. Obviously, the team notices it, and it makes the day go faster. It makes the day way more enjoyable because it's like, I'm not doing this alone. I have everyone here to help me. If I needed help, they could. Like you said, I think we have a great team. Yeah. But to me, that's what makes a job worth staying at, is all the people willing to help and be there for each other, because it just makes the day so much better. You don't dread going to work knowing I'm going to be doing this by myself and no help. And it's going to be stressful. If I need help, I don't know who to ask. It's like, ask anyone.
Yeah.
And so
it really is. It's a huge difference. And I'm being a travel nurse, not just being on different units, being in different hospitals. The culture is so key. It's so key because when you are new or you did float to that floor or whatever, you see everybody else asking everybody else for help or asking, do you need a hand? Do you need this? And it kind of just rubs off on you, right? Like you just start doing it because people are doing it for you. You do it. It's like, it makes the situation so much better. Sarah, I really do appreciate you. Just a couple more questions. And this is a little outside of nursing, but it helps with being a nurse. Being a nurse is super stressful. Every time I see you at work, you're like smiling ear to ear. You're ready to go get it. You're always super helpful with the patients. Like, you seem very happy at work. I don't know if you've ever been on the brink of burnout. I don't know if you've ever been like too stressful, cried your way home from work, cried at work. I don't know if these things happen to you. It just, you seem impeccable. You seem impeccable. But how do you set yourself out outside of work, at work? What are the things that you do to make sure you don't burn out? So when you do have a stressful day, you can calm down afterwards. What are the things you do to help make sure that you don't bring all of the stress from outside of work into work every day?
Totally. And to answer your question, I felt like I felt a little bit of burnout before I went down to Cath Lab, only because it was just getting repetitive. I think that was the hardest part for me. I was getting a little repetitive, even though I have been a nurse for a short time. I had been on the unit for a while. It was just kind of same old. I would need something new, but I love the people. I love everything about that unit. And to do that, I'm like, I always say that my passion at work is cardiac. I love cardiac. That's my thing. My passion away from work is gut. I love learning everything about the gut, everything about like to make a healthy gut, happy gut. And I focus strongly on just what I'm putting in my body, what I'm doing to my body. I've always been a big exerciser. I love getting out, getting sunshine, taking care of myself. I'm like such a foodie. So to help me, I like pack my breakfast, pack my lunch for every work day and like have it good so I can look forward to that, because it's like when you're snacking here and there, you're not getting a full meal, you're not nourishing yourself. And that's what I would also say is like, you have to take time for yourself on your work days, on your non-work days. On my work days, for me, I have to have a cup of coffee before I get started. And so I make sure I get that in. To be honest, I get like a little bit like, ugh, like kind of mean when I'm like, and I don't even think that it's the coffee itself. It could be a cup of tea, but to take that time to look at my patient. So for me, I always got there 30 minutes early to just know that worked for me. I have my coffee. I have my time before call bells start going off, before I'm actually clocked in. And sometimes I would get some time after report to finish looking things up. Sometimes I wouldn't. And you have to be okay with that. But just creating a routine for myself. And then, I just kind of had my routine. I would always see my patients and then go eat breakfast. And if it was getting to be 11, 12 o'clock and I hadn't had breakfast, I'm like, okay, I have all these tasks to do. Where in this can I grab a bite to eat? Because I'm going to not take care of my patients well enough if I go without food. And I see that all the time as nurses are like, I didn't have time for a lunch. I don't know that I've ever worked one day that I didn't take a lunch. And, maybe it's 15 minutes, maybe it's a shorter lunch than I want, but you have to at some point step off the unit. It's not even about nourishing your body and getting food. It's about shutting your mind off, getting away from all the calls, all the everything, and just taking time for yourself for a couple minutes. I've always been big on that. Is like, and it, like we talked about with teamwork, is like, you have to make sure everyone else gets that too and help them out so they can get a break. They'll help you out so you can get a break, but just kind of be selfish in that realm, because that 20, 30 minutes of selfishness is going to make up for all the other, grace and positivity that you're giving your patients. Whereas when you had to take a lunch at 5 o'clock, between 2 and 5 o'clock, I'm like, I have to go back and apologize to my patients for being such a grouch. It's like, they don't want to be there either, but you just have to kind of put yourself in their shoes and stay positive, because if you're negative, it rubs off on other people.
It really
And
does.
then you just have like a whole day of negativity. And it's like, who did that? Nobody did that but you, to yourself. And so if you can be positive, even if you're kind of faking it, you're tired as heck, but you're faking that you're positive, it's going to rub off on other people. And then before you know it, it's noon and like everyone's being a little bit more positive because you did that.
Yeah.
So I'm like, I always try and be positive, if not for my patients, for my coworkers, if not for my coworkers, for my patients, if not for anyone else, for me, It's like, you're never going to hurt anyone by being positive. So just try.
I love that. And I, in nursing specifically, I don't know if it's just nursing. I think it's like in many professions, but going a full day without a break sometimes comes off as like a badge of honor, where the truth,
no.
Right. But the truth is, it's like, you had a super busy day. You didn't have time for a lunch, but now you're really mad. Now you're upset. And then you have like a building of resentment. I never get to take a break when I'm at work. No one's helping me out. I don't have time. You're meaner to the patients. You're a little bit more grouchy. Like it builds and it builds and it builds and it builds, right? All of these little things. Take that time every day for yourself.
Yeah.
If you need 30 minutes prior to work, do it. If you need your coffee, do it. If you need your break at 2 p.m., do it. Make sure it happens. Talk to your team. Make sure these things happen, because it's so important. It's so important.
Right. Absolutely. I agree.
Anything else that I haven't talked about? Anything that you wanted to mention? Anything that you would like to share at all? Please, Sarah.
Oh, gee. Well, I don't know. I feel like nursing right now, especially as a hard profession, we're like at the very turn point of like coming out from COVID and then going into this new world. I worked as a CNA before COVID, and it did seem a lot more relaxed. People had hard days, but now it's like few and far between. You have a doable, easy day, And so they're becoming more we're getting better at, not changing things every 2 seconds like they did during COVID. And God bless everyone who was involved in COVID, from the higher ups to everyone in, all along the spectrum, because it's like no one knew what to do and we were all just
Exactly.
scrambling. And it's like, of course you can be mad and this and that, but it was just a bad time for everyone because no one knew what to do and everyone's apologizing and trying to figure things out. And so they keep telling us to hang in there, but I feel like there is a hope. There is
Yes.
a light at the end of the tunnel.
I feel
It's
like I'm
coming.
starting to finally see it, right?
Yes,
Like it was a really long time. I was like, this is never going to end.
I know. You're just like, I don't know, but there is a light. We have to be there for each other. We're there to work with each other, not against each other. We entered this profession. And the other thing is I become like a huge advocate for is I actually have a second job. It's at just an outpatient clinic. It's a very easy job, it's a very different job. But nursing has a million jobs. And recently, especially after COVID, I had so many friends come to me and say, I think I'm going to get out of nursing because I just don't think it's for me. And I'm like, I don't think that's true. I think you've had a bad experience in this job. I think you just need to switch up your job. It changes your whole life. It changes your whole quality of life when you just get a different hours, different days, different place that you go, something. Just try something different, but don't give up on it. Try a couple places because there's a million places that need nurses. You could be a
Yeah.
school nurse, you could do dermatology, you could do clinic, you could do hospital, you could do OR. There's a million things. So give it a try. Don't give up on nursing. It's a fun profession.
Yeah, it really is. And like, and that's the key. Like, if you are a bedside nurse and you're like, this isn't for me, that does not mean nursing is not for you.
Exactly.
Yeah, that does not mean nursing is not for you.
You
There's
could do
so many,
teaching. You could do
exactly.
anything.
Clinicals, whatever you want to do. If you don't want to be doing the bedside, there's a million ways to do it. There's a
Yeah,
million ways to be a nurse. And that's the beauty of nursing. It's
it really
actually
is.
lovely. Before I let you go, do you think you'll ever, when like, if we ever get to the point where it's like masks are not required, do you think you'll ever not wear a mask at work? Do you enjoy having a mask on at work?
To be honest, I like wearing a mask at work
It's
because
crazy,
it's just
right?
like comfortable. And I'm like, I've gotten to the point that's Q. That's probably why you think I'm so happy all the time because my mask, because you can't see what my face is doing. I'm like this all day. No, I'm just kidding. um, but I think I like probably make different facial expressions. I mean, and if everyone, I think it's going to phase out and people are not going to wear masks eventually. I personally think it will take years,
Yeah.
but I think it's going to be a hard transition when they say you don't have to, because I think a lot of people are going to keep doing it and then you're going to feel obligated. It's kind of like a vaccine. It's like, do I
Exactly.
get it? Do I not? I feel pressured. I don't, you know, and then you're like kind of just going with what other people do. And I don't really know. I like having it because in nursing, there's so many smells and there's so many like things. And I'm like, this is just nice to have. I don't want to be spit on. I don't want to be, you know, but we did have a time that we didn't wear masks and that was okay too. So I do like it. Sometimes I'll pull my mask down. Patients like it more when they can see your face, see you
Yep.
smiling. They're like, oh, I can see your face. And so I'm like, okay, yeah, you're right. So I
And a
don't know
lot of
what I'm gonna do.
and a lot of hard of hearing patients need it. Like they need to see you move your
Yeah,
lips.
yeah,
But it's crazy to think that there was a time prior to masks, because now wearing a mask, I'm just like you. I'm like, how were we nurses and not wearing masks 24/7? It's
I
kind of
know.
crazy. It's kind of crazy. Last thing, I promise, I promise.
Oh, you're fine.
You talked about all the good things that you do outside of work to make sure that you're a healthy human being. What are your guilty pleasures? What are you watching on TV? What are you like when you're not doing like the gut healthy thing? Like, what are you snacking on that is not good for you? Like, what are the pleasures that you allow yourself?
Okay, I have plenty of them, so we could go on. You said last thing, but I mean, I could be here for. No, I'm just kidding. Well, I'm a chocolate fanatic. I love chocolate, so that's my guilty pleasure. I like every day. Every day, I have a little chocolate,
There you go.
and so I do love sweets. So sometimes I go above and beyond and eat some sweets, but I love a good happy hour with some wine and some time out. I love some good wine, so I do love that.
Red or white?
I'm more of a red fan, but I do like white occasionally in the summertime.
There you
So,
go.
I love that. My real guilty pleasure in the summer is sitting in the sun for hours on end. I know it's not good for you, but I just love it. Soaking up the sun and just baking, getting super tan. So I love that. I love I'm a reality TV show fanatic.
Oh shoot, which
Like,
ones? Or all
are
of them?
all of them, but Kardashians are like my go-to. Anything reality TV, I'm all over that. So sometimes I'll cave and watch that. But I love cooking. I love being outside. It's so wonderful. I become a hermit in the winter time, and I'm
Yep.
like so over this cold.
Yes.
And so I love doing that. I don't know if I have any other guilty pleasures. I love shopping. I'll like shop forever. But
Oh,
I like to ball on a budget.
there you
So
go.
I'm like, get all the deals, and then I feel even better.
Well, good for you. I do see the love in the background. I know you mentioned your fiance. I know when you were on the floor, I don't know if you were planning your wedding or everything's all set, but I just want to say congratulations on that because that's huge too.
Thank you. Thank you. Yes, newly engaged in
Congrats.
December.
Congrats.
We're getting married this October. So that is my new guilty pleasure, planning everything and making my fiance just itching all over because he's like, "Can we not talk about the wedding?" I'm like, no, no. He loves it too, though. So,
um,
but thank you. Thank you. Yes, we're excited.
Oh, good. Sarah, this was fantastic. Like I said prior, if there's anything that you said, if there's something that you don't want in here, you let me know. But
Okay.
it was an absolute pleasure. Do you want people to know your social or are you okay?
Sure. I don't care.
Okay. Well, what are the socials you want people to find you at? Go ahead and shout them out.
You can do my Instagram. It's Sarah Sarah, SARAH underscore Hos HOS1. I really only use Instagram. I'm
Well, there
not
you
that
go.
exciting.
Well, do me a favor and just send that to me, and then I'll
Yeah,
just have it on the screen, and then I'll have it in the description box below, above, wherever you guys see the writings.
sure.
Thank you so much. Have a great day, and if I don't see you, have a fantastic wedding.
Thank you. Thank you. Thank you so much for having me on. It was so fun. And I
Well,
am
good.
honored that you asked me to be on. So I'll definitely be seeing you. And I can't wait to hear all the things you're doing as well.
That's right. Have a good night.
Okay.
Give a good
You
day.
too. You
All
too.
right. Bye
Bye
bye.
bye.